From Faith Forward Media, this is Healthcare Musings. I'm Dr. Hashem Hasabala. Hey everybody, Hashem Hasabala here on Healthcare Musings. Happy to have you with me. You know, with the increasing amount of vaccine skepticism among the general public, and there's a lot of reasons for this, and it's not just about RFK Jr. Now being nominated to head the Department of Health and Human Services. I think this has been growing for a long time, and I just wanted to make sure that we remind people how bad these illnesses can be. And the first one I want to talk about is measles. Just for context, according to the World Health Organization, worldwide in 2023, there were an estimated 10.3 million cases of measles, which is a 20% increase from the year before, according to new estimates from the WHO and the US CDC. And of the 10.3 million cases, the new data showed that 107,500 people, mostly children younger than the age of 5, died due to measles in 2023. This thankfully was an 8% decrease from the previous year, and that's a lot of kids. 100,000 kids died of measles. Measles is no joke. And just wanted to kind of go over what is measles. Measles is a virus. It's a virus. It's a viral illness. It occurs worldwide, and it is very highly contagious. It can be transmitted in public spaces, even in the absence of person-to-person contact. Super contagious virus. It is characterized by fever, not feeling well, cough, runny nose, stuffy nose, conjunctivitis, red eyes, followed by a rash. And the period of you can be contagious from about 5 days before the rash to about 4 days after the rash. And just to kind of remind, now I have never seen a case of measles, and I've been a doctor for more than 20 years. I've never seen a case of measles because most of us are either vaccinated, or those who aren't vaccinated are protected by their herd immunity because most people are vaccinated. In fact, around the world, there are a lot of countries that have eliminated measles because of vaccination. And now that with less people getting vaccines, and there's a lot of reasons for this, and I'm not going to go into that right now, more cases of measles are coming up. So just to kind of understand what the clinical manifestations. So the incubation period is between 6 and 21 days. And usually the prodrome lasts 2 to 4 days, and it's fever, fatigue, malaise, anorexia, don't feel like eating, red eyes, conjunctivitis, runny, stuffy nose, and cough. And then you get a rash. The rash looks like, in the beginning, looks like grains of salt on a red background. And then it's followed by an erythematous maculopapular blanching rash, which begins on the face and spreads up and down to involve the neck, upper trunk, lower trunk, and extremities. And you can Google what a measles rash looks like. And so there's a whole bunch of different kind of, there's like modified measles and people who had measles or had pre-existing condition immunity. There's atypical measles when they got a different kind of vaccine, which we no longer use. Here's the thing, and this is why I'm trying to say that measles is no joke, guys. One or more complications occur in approximately 30%. That's almost 1/3 of measles cases. Now, the most common is diarrhea, but if diarrhea is really bad, right, you can get dehydrated and hospitalized, and it can cause organ dysfunction like kidney failure. Measles infection can suppress the immune system and put you at risk for secondary bacterial infections, right? Pneumonia. Pneumonia is the most common cause of measles-associated death, and it occurs in approximately 6% of cases. And respiratory tract infections occur most frequently among kids less than 5 or people greater than 20 years of age. Again, that's a lot, guys. That is bad. Measles is not a thing you want. And then measles has a lot of neurologic complications that I think, again, we don't see that, right? It can cause encephalitis, which is inflammation of the brain, acute disseminated encephalomyelitis, and then this really scary subacute sclerosing panencephalitis. The encephalitis occurs in up to one per 1,000 cases of measles, and the same thing with the acute disseminated encephalomyelitis, 1 per 1,000 measles cases, right? I mean, it's bad, right? And then you have this subacute sclerosing panencephalitis, which can occur 7 to 10 years after natural measles virus infection, and it's a progressive degenerative disease of the central nervous system, and they found that when vaccination rates go down, cases of SSPE go up. Okay, and so the best way to prevent measles infection, which is again no joke and it's a big deal, is to get vaccinated. And so, kind of, and then before I get into that. Groups that are at risk for complications include immunocompromised people who are, chemotherapy or on steroids for whatever reason, or other kind of immunosuppressive drugs, and pregnant women. Pregnant women can get pneumonia and can get encephalitis, and they can have adverse maternal, fetal, or neonatal outcome. And then and there was one study that they looked at 55 women in Namibia. 12% of the women died. So again, measles is no joke, guys. Now, okay, begs the question, how about the vaccine? Is the vaccine benign? Is any vaccine benign? Absolutely not. No vaccine is harmless. And if people, any kind of confusion on that was wrong, right? Vaccines are not benign. Vaccines can cause complications, and I'm again not going to get into the whole thing about the COVID vaccine and everything like that. I'm not going to get into that. So the vaccine against measles is called the MMR, and it is a live attenuated virus, meaning it is a live virus, but it is weakened, so it shouldn't cause an infection of the wild type or regular virus. It's a live attenuated vaccine. So what are the adverse effects? Fever develops in 5 to 15% of recipients, usually within 6 to 12 days after immunization. You can get transient rashes. Okay, you can get transient swollen lymph nodes, meaning temporary joint complaints. Usually there are some hypersensitivity reactions, like maybe a little bit of hives, because they do put, and I don't understand why, they do put trace amounts of neomycin or gelatin in the vaccine. There is a risk of developing low platelet levels, immune thrombocytopenia, but it's pretty rare. And they said that the estimated risk of ITP after MMR vaccine is 1 in 40,000 cases, and this is half as much as the natural infection, which is 1 in 20,000 cases. And when they looked at it in a systematic review, thrombocytopenia resolved within 6 months in 93% of cases. There are some kids who get seizures with fever, and so it can cause febrile seizures. And then they did studies. Does the MMR cause encephalopathy or encephalitis? And they found no association detected in a meta-analysis of 2 observational studies. And then the question of whether it causes SSPE, that long-term kind of neurologic condition, is controversial, they say. So yes, MMR vaccine is not benign. At the same time, it is much better. Okay, and let's stop here. When you get a fever, body aches, I got my tetanus booster in med school, and I was sick as a dog. I had a super high fever, shaking chills. My arm was killing. I missed my Alpha Omega Alpha dinner, my honor society dinner, because I was just out from the tetanus booster that I got. And that is the consequence of the immune reaction to the vaccine, right? It was my booster, and so it's just, that's what happens when the immune system is activated. You get these fever and body aches and shaking chills and everything like that, and it went away in a day or two, and I was fine. Now there are some vaccines that do cause some severe, due to the immune reaction, can cause some complications, just like myocarditis in young men who got the COVID vaccine. That's That's true. That is a consequence of the immune response. But just simply saying I have that it's bad that I got a fever or body ache, that is due to the immune response. But to me, measles is such a bad disease, and vaccination has been shown to be life-saving. It saves literally millions and millions of lives when you get vaccinated. I just think we just have to be aware of how bad measles is, and it's not 100%, and nothing in life is 100%. But to me, the risks associated with the vaccines, in the right cases, in the right patients, are way, 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 way less than the risks you bear by, winging it and possibly getting measles infection. Anyway, thanks so much, guys, for your time and attention. And until next time, Hashem Hasabala signing off on Healthcare Musings. Thank you for listening. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.